Hello, I'm Dr. Philip Paulk. I'd like to thank you for taking a few minutes to learn about our approach to managing your blood sugar problems. You may ask yourself, why me? I've done everything my doctor has asked me to do. I'm taking my medication as ordered, but I feel like I'm still getting worse. I hope to answer some of your questions in the next few minutes. I've been in practice for over 36 years. I am a board-eligible chiropractic neurologist and board-certified in chiropractic biophysics. I'm on the extension faculty at Life University and have been published in medical journals. I consult with a group of over 400 doctors from around the country who practice in the same manner that I do. So, what the heck is diabetes? Well, it's a chronic metabolic condition in which the body cannot metabolize carbohydrates, fats, and proteins because of an ineffective use of insulin. There are three primary types. They are a different disease entity but share a lot of the same symptoms and complications of high blood sugar. It is a bad thing to live with, and it's a bad way to die. There are a lot you can do to prevent it, or there's a lot you can do to help it if you do have it. This slide demonstrates some of the symptoms of type 1, type 2 diabetes. As I said earlier, there are three types, type 1, type 2, and type 3. In type 1 diabetes is referred to as insulin-dependent diabetes mellitus or juvenile onset diabetes. This type is an autoimmune reaction where the beta cells in the pancreas are destroyed. It can be brought on by environmental exposures, viruses, toxins, and stress. And of course, there is a genetic predisposition. In type 1 diabetes, the current medical treatment is insulin by injection or pump, diet, exercise, education, and monitoring. Type 2 diabetes is the most prevalent, and the numbers are growing. It is the number one cause of blindness, is the one of the big causes of kidney failure, and is the 7th cause of death in this country. 60% of diabetics have some form of peripheral neuropathy as well as sexual dysfunction. Type 2 diabetes is referred to as non-insulin-dependent diabetes mellitus or adult onset diabetes. The main causes are insulin resistance, decreased insulin secretion, or excess production of glucose from the liver. In type 2 diabetes usually occurs after 30 years of age, but is now occurring very often in children. If you have a family history of diabetes, you're 3 or 4 more times likely to develop the condition. These people are frequently overweight and may or may not have symptoms of high blood sugar. Many people experience extreme tiredness, blurred vision, delayed healing, numbness and tingling in their hands and feet, and reoccurring yeast infections. Children between the ages of 10 and 19 who are overweight have a sedentary lifestyle, have a family history of diabetes, and if they have high blood pressure or high lipids or polycystic ovarian syndrome or members of certain ethnic groups, they have an increased risk of developing type 2 diabetes. Medical treatment for type 2 diabetes is education, monitoring diet, weight management, exercise, oral anti-diabetic medications, and treatment of other conditions such as high blood pressure or high cholesterol with pharmaceuticals and their attendant side effects. There are blood sugar issues such as insulin dependence, insulin resistance, and hypoglycemia. With hypoglycemia, there are symptoms of low blood sugar which include shaking, hunger, sweating, headaches, rapid heartbeat, mood changes, and change in vision. Many people on diabetic medications experience periods of hypoglycemia. Insulin resistance is many times a precursor to development of type 2 diabetes. You may have noticed that recently there's been many of the drugs used to treat diabetes have come under more scrutiny by the FDA. So what are we to do? There are many things that affect chronic diabetes. There's chronic inflammation, there's bad adrenal glands, bad blood sugar regulation, hormone imbalances, even neurological imbalances. There can be active antigens such as chronic infections of bacteria, viruses, and mold. You can have parasites in your gut. You can have environmental toxins and environmental toxicity, undigested food. Gluten sensitivity has been implicated in autoimmune conditions. You can have protozoa in the gut which can trigger some of the diabetic symptoms. Of course, diabetes is a sign of metabolic dysfunction. Proper testing is crucial. There is a tremendous amount of information that you're probably not aware of. If you're suffering from diabetes or think you may be suffering from diabetes, you need to attend my workshop and hear the whole story. I've had many patients get their diabetes under control, reduce or eliminate their medication, lose weight, and get their life back. These workshops are held on Tuesday evenings at my office. There's no charge, but you must pre-register. So you can call my office at 770-474-1421 to reserve your seat. We do not accept walk-ins, so you have to pre-register. You can also go on my website at thepalkclinic.com and connect to Facebook for reservations. I appreciate your time, and I'll see you there.